Hello again. So I thought that I was going to change the topic from medical to theological and talk about consciousness or what is consciousness or what is self. And I'll probably do that next time. But over a period of last 1 week, I was a little bit busy and could not do anything. So I'm going to talk today about probably the last one on obstructive sleep apnea, at least for now. So this is the continuation of treatment of obstructive sleep apnea. And there are alternatives to various standard treatment. So let me talk first about the obstructive sleep apnea as we defined it. Anytime when somebody stops breathing or does not breathe deep enough with a drop in oxygen, so the depth of the breath goes down by 30% and the oxygen saturation drops by 4%, which is called hypopnea. When we combine these two events and calculate per hour, if they're greater than 10 to 20, then it is called mild. If it is 20 to 30, it is called moderate. And when it is greater than 30 per hour events like that, it is called severe sleep apnea. 5 to 10 is a gray area, less than 5 is supposed to be normal. So when people have symptoms and have apnea, hypopnea index of 5 to 10, then we consider treatment, especially if it is associated with drop in oxygen of substantial amount. So this is actually the sleep apnea definition and the treatment. So the treatment options which we talked about, and I showed you some masks last time, is the positive airway pressure or PAP therapy, PAP, positive airway pressure. And then there are different varieties of them. Automatic adjustment in the pressure is called auto PAP or APAP, where the machine has an algorithm with which it determines the needed pressure to maintain the breath at the same level. So if the breath is reduced by a certain percentage, pressure is created to bring it back to the normal pressure, normal level. If there is total apnea, then the pressure is created to bring it back to the normal level. So essentially this is an auto PAP or APAP. The pressure will change from breath to breath, pressure will change from person to person, and the pressure will change from time to time, including different days. So that is called auto PAP. The BiPAP level or BPAP as it is called, the pressures are different when you are breathing in versus breathing out. With a CPAP, C stands for continuous. Again, the PAP is positive airway pressure. The continuous airway pressure or CPAP, the pressure is fixed. So if we set somebody on pressure of 8 or 10 or 15 or 20, during the entire cycle, breathe in, breathe out, awake, sleeping, the whole pressure remains the same. So if there is a breath where the pressure needed is higher, you will not get higher pressure. If there is no need for the pressure to be generated, then it still is there. So sometimes when the pressure required is higher, more than 10, 12, some people have difficulty sustaining a breath, especially during the expiratory phase, because this is the pressure against which you are breathing out. So it becomes difficult to breathe out against that pressure, so people use BiPAP. The pressure during inspiration is higher, pressure during expiration is lower, so the pressure against which you're breathing is lower and people tolerate that better. This particular concept of tolerance of BiPAP being better than CPAP is not true for 100% of the time, but certainly if there is an intolerance to the CPAP, continuous positive airway pressure of same amount, certainly one could consider doing a retitration and change the pressures. So that is called BiPAP or BPAP. So there is an auto PAP, there is a CPAP, there is a BiPAP. The next one, alternatives to this, and then I will talk about the compliance, is other methods. So the mask is your choice and you have to be compliant. For the pressure to be effective and helpful for control of obstructive sleep apnea and help your blood pressure and diabetes and atrial fibrillation and maybe even depression, dementia, reflux, asthma, many other conditions that it seems to improve, we must use it for more than 4 hours every night on 80% of the nights. So in a month of 30 days, you must use this for 25 days at least. Every night, longer than 4 hours would be great. Entire night would be greatest, but at least 4 hours to see substantial improvement. And compliance is needed by insurance companies, including Medicare, to continue to pay for the supplies as well as the machine. So compliance is measured automatically. There is a smart card in it. Data can be downloaded, or it could be nowadays with newer machine can be obtained by Wi-Fi. So the patient himself or herself can download the app for the machine and see their own compliance. And they also can see the events. Events is number of times while you are on the machine, you had stoppage of the breath. Number of times you did not breathe deep enough. Number of times there was a significant air leak, and the average pressure. So if the pressure is fixed, then of course you don't need to worry about it. So this particular thing is called compliance data, which is absolutely essential, especially if somebody needs a DOT certificate for driving trucks or vehicles or pilots. And they need to have that compliance later. And they need to prove that they're using it and their help with it. But it is also important for treatment of the disease itself. Now, as I said, that in addition to the compliance, if there are more events which are seen on this particular data, that means, let's say we start somebody on 8 centimeter CPAP, and we see that his apnea-hypopnea index downloaded on 8 centimeter usage when patient is using is say 10. That means the patient is not well controlled and the pressure needs to be adjusted. So the events that are downloaded on the phone or that can be downloaded on computer and the compliance both are helpful in guiding the appropriate pressure and the treatment and helpfulness to the patient. So it is an absolutely must. Those people who are smart enough to download the app on their phone can monitor their own. Physicians certainly have an ability to download the data from computer, and that will guide to see if the pressure is needed to be higher. Accompanying this CPAP, BiPAP, APAP use, weight reduction is absolutely essential, and there are some formulas which suggest how much pressure reduction would occur if somebody loses X pounds or X percentage of BMI. So that is another thing which is important. So weight loss, appropriate use, compliance, event monitoring is an absolute must for monitoring of the pressures. The alternative to CPAP or the pressure to CPAP, AutoPAP, BiPAP is something called mandibular advancement device, which is like a bite block or a dental device. This is customized, and customized ones are expensive, cost as much as $2,500, while the one that you can buy on the internet costs anywhere from $300, $400 to about $800, but they're not custom made. And their effectiveness is good when apnea-hypopnea index is low. So for example, if somebody has 15 or 18 AHI and they cannot use CPAP or AutoPAP or BiPAP, then this mandibular advancement device would be helpful. It pulls the lower jaw or the mandible forward. As you can see, it is very limited. And if it drops from 18 to say 6 or 7, you are successful. The second thing is something called positional therapy. Events are much more when you are lying on your back. So there are t-shirts available where you can put a couple of tennis balls and they poke your back so you're always on the side. This is called positional therapy. There are surgical approaches and there are some other approaches that have been tried, came, and lost. I would not talk about them right now because that's a very specialized thing. but certainly a positional therapy in combination with mandibular advancement device would be helpful in a milder variety of sleep apnea. So I think this explains the apnea and treatment, and we will go to a next subjects next time. Thank you for watching. Hope you like and subscribe. Have a nice day.